This is the Voice of the Cape. My radio station, your radio station, our radio station. 95.8 and 100.4 FM stereo.
Thought-provoking, hot and never really dealt with. That's lifestyle issues on the Voice of the Cape. Welcome back to the Voice of the Cape. As jy net aangesluit het, welkom by die stadse gunsteling nommer 1 gemeenskap radiostasie. This part of the show, we move on to the South African Inherited Disorders Association, while we move on to bladder weakness. So, listener, if you were asked which health issue has the highest rate in South Africa, well, hey, if your answer is HIV/AIDS, nope, that is not it. The correct answer is bladder weakness, involuntary leaking of urine. But joining me in the studio to tell us more, I've got a specialist gynecologist. He's from Groote Hospital, Dr. Stephen Jeffrey. Hello, good morning to you, Doctor.
Good morning, and thank you for having me.
Absolute pleasure. All right, so we'll kick off right away with what is urinary incontinence.
So urinary incontinence is a problem of involuntary leakage of urine, and it affects, as we've already heard this morning, a large number of women and men. I basically specialize in women's problems, so that really is my focus.
Okay, so that pretty much answers who is at risk of contracting it. What about stats available?
Yeah, so it's very difficult, but as we already heard, it's far more common than most of us would imagine. And the statistics vary from which population you look at, but it can be anything between 1 in 5 women to maybe even more, up to 1 in 4 women can actually suffer from this problem. So yeah, it is actually very common.
Mm-hmm. So the signs and symptoms, what do you really look out for? When does it start? And perhaps also at what age?
So it can affect women of all ages, but as women get older, it seems to become a little bit more common, and often related to childbirth. So you might be listening and might relate the onset of the symptoms to when you had your baby, and that's when a lot of women find that it seems to occur. But it can be related to a lot of other things. We know that it occurs in a lot of older people as well. But certainly from about the 40s, we see quite a steep rise in the number of women who actually are suffering from this problem.
So, Doc, you've mentioned it can happen because of childbirth, right? So, if I, for example, as a young woman have a baby every single year, all right, is that perhaps one of the reasons why women opt to have C-sections?
So now we're getting into quite a controversial area, aren't we? And I think this topic is discussed at length in a lot of places, and tea groups, mothers groups, and everywhere. So the protective effect of a cesarean section is certainly there. But if you look at the data on the role of cesarean section in preventing things like urinary incontinence, we know that it's protective for about the first year or two. But that protective effect seems to disappear as women get older, as the influences of other things that weaken the pelvic floor start to have the impact. And so 10 to 15 years after you've had your cesarean section, the protective effect of that might have disappeared. So unfortunately, not really as protective as we would imagine.
I think most women really, and I've been having several discussions around this as well, and most of these women say, well, you know what, because of that, I don't really want to have normal birth. I'd rather have the C-section. So...
yeah, as I say, and not as protective as we would imagine. It seems to be a little bit more protective for something like pelvic organ prolapse. So some women might find that they've got, the bladder dropping, the uterus sort of protruding, and a little bit of protrusion through the vagina. Cesarean section is probably more protective for that problem. But for urinary incontinence, not as protective. And if you look at some of the data, you can actually see that a lot of women have some symptoms during pregnancy already. So we know that it's the pregnancy that seems to have the impact and not the delivery itself.
Right. But it's just because of that perception that, if I'm going to push and push and push, and I'm going to do it year after year and have 5, 6, 7 babies, it's probably going to increase my chances.
So a lot of the work has actually started to focus on what might happen around the delivery and the weight of the baby. If you have maybe a instrumental delivery, you might have a vacuum extraction, or you might have a forceps delivery. Those certainly do have a bigger impact on the pelvic floor.
Okay.
And so not all deliveries are the same, and so it's been quite an interesting area to look at. But again, cesarean section, not the cure and the preventing of all urinary incontinence.
Okay, so back to the forceps delivery, Doc. If I, hypothetically speaking, had a forceps delivery, right? Does it then increase my chances?
Yes. We know that a forceps delivery has quite a big impact on the pelvic floor. Unfortunately, unfortunately, the problem is that by the time a woman requires a forceps delivery, there might be some obstruction already. So there might have been some damage done already before the doctors even placed the forceps. But in some cases, unfortunately, the forceps is a life-saving procedure for the baby. And you
don't really have a chance at that or choice at that point in time.
Exactly. So that's the problem.
So how is it treated, Doc?
So you get different types of incontinence, and I'm sure there are women listening who can relate to what we're talking about. The one type is what we call stress incontinence, stress urinary incontinence, and that's not related to stress caused by your husband or stress related to your children getting in trouble. It's the stress related to increasing your intra-abdominal pressure.
Okay.
So that would be something like coughing, laughing, sneezing, and all other activities, and that places stress on the already weakened valve at the bottom of your bladder, and that doesn't close properly anymore. And so when you cough, you might find that you've got little spurts of urine coming out of the bladder. That's the one type of incontinence.
And I've heard a lot of older women actually complaining about that.
Yes.
And that is why you've mentioned when you're over 40, that's really when it starts.
Exactly. And then you've got another type, which is actually quite different to the one we've already spoken about, and that is what you call urgency incontinence.
Okay.
And that is when you feel that you need to go to the toilet and you just can't make it in time, and you find that before you get there, you're really sort of wetting yourself. And that's called urgency incontinence.
Okay.
Also very inconvenient and really having a really big impact on the quality of life of women.
I can imagine.
Yes. So those are the two types. Yes.
Sorry, Doc. Especially, if you still, most women work up to 50, 60 years old just to, stimulate the brain cells and just to feel that they still, matter. They're still making a difference in the community. They're still making a difference in other people's lives. And if you look at the women today, most of them work till about 60, 65 years old. So imagine you're in this working environment and you have a problem like urgency incontinence. It could be terribly embarrassing as well.
Yes, and there's been some work done on this, and there's been some research, and we know that up to 3% of women have been shown to change jobs simply because of the fact that they've got this problem of urgency. You can imagine a woman working at a till, say in a supermarket, who has got very strict rules in terms of how when she's allowed to leave to go to the toilet, and you can imagine the impact of the quality of her life by this problem of urgency incontinence.
And how do you explain that to the person that you're working for?
Well, I mean,
that's difficult.
Yeah, well, that's the importance of possibly creating an awareness of this problem, and how common it is.
Doc, do you think enough awareness has been created around this? Do you think there are enough awareness campaigns?
Certainly not.
Okay.
I think the importance of awareness is the fact that a lot of these conditions are actually treatable, and
we'll talk about that when we get back. Luisteraar, presies 20 voor 11. Ons breek vir advertensies, bly geskakel vir Dr. Stephen Jeffrey. Thought-provoking, hard and never really dealt with. That's lifestyle issues on the Voice of the Cape. Well, hey, if you have a weak bladder, if you've been a little bit too embarrassed to talk about it, don't be, all right? Because like Dr. Stephen Jeffrey mentioned, he's my guest in the studio, he's also a specialist gynecologist at Groote Schuur Hospital, a man with many, many years experience. You're more than welcome to call us up. If you don't want to chat to him live on air, I've got my producer on the other side, Kanita Kamar, taking your questions off air on 442350. You can ook stuur your SMS's na 34530, that is 34530. Now, we're chatting about urinary incontinence, all right? Now, Dr. Stephen Jeffrey, you've pretty much covered, you've touched on stress incontinence, urgency incontinence, and you now want to move on to overflow incontinence, Doctor?
Yes, so we're just talking about the signs and symptoms, and we know that overflow incontinence is an interesting condition in that it occurs in women who are unable to empty their bladder, and their bladder would fill, and for some other reason they might have some obstruction, or they might have just a very weak bladder muscle. And this does commonly occur in women who might have had surgery, previous gynecological surgery, and we know that as women get a little bit older, the bladder stops working effectively, and so this might also be a reason to go and see your doctor, and this might be one of the third sort of main cause of urinary incontinence in women.
And also, as you become older, and you've mentioned when you're like over 40 years old, the wall is not as strong compared to a 20-year-old, right?
Exactly. So we all know that the pelvic floor starts to get weaker. The tissues aren't as sort of supported as they used to be, and that's why women seem to get this problem more commonly.
Okay, so we're going to move on to the next one because there's quite a few, right?
Yeah. So I think it's important that we talk a little bit about treatment, and as I've said, you've got the two different types of incontinence, three different types of incontinence. Now, the one is managed with surgery, and the other one is not managed by surgery, and it's really important that your doctor gets this right.
Okay.
And I think it's important that you get referred to someone who's manages.
Like Dr. Stephen Jeffrey, a specialist.
Well, I basically work in the state, but I mean, there are a lot of good private doctors out there, and do your homework, and I'm pretty sure there are a lot of good doctors in Cape Town who are able to manage this problem, so that's absolutely fine. So I think if we're talking about the surgical interventions, that would basically be those patients who got what we call for patients who got stress incontinence.
Okay. Is there anything that can be done to prevent it? Because I'm pretty sure that's the question that's going to pop up for most women.
I think we've already spoken about cesarean section.
Yes.
The protective effect of a cesarean section is there, but it does, as I already said, it seems to dissipate with time.
You've mentioned 15 years?
Yes, I think some of the studies showed that when they looked after about 10 years after the woman had actually had her delivery, whether it was a cesarean section or if it was a vaginal delivery, the protective effect of the cesarean section had basically disappeared.
I'm going to tell you, Doctor, I've got a girlfriend and she said, "Oh, no, absolutely not. I'm so not having that delivery. I'd rather just opt for the C-section, So, and that was one of the reasons, by the way.
So something that you might have heard about, and these are the Kegels exercises. Now, Kegel.
Oh, yeah, that's great. Definitely works.
Now, Kegel was a German physician who developed in the 1950s, developed these exercises that you contract your pelvic floor. Now, that might be a good idea. Unfortunately, you have to do them correctly.
Because it tightens the muscle.
Yes.
Yeah.
And Kegel's exercises during pregnancy have actually been shown to possibly reduce the prevalence of stress incontinence. But that's basically the only thing that other than cesarean section which can possibly prevent it.
Doc, just before we continue, just an SMS that came through from a listener, and the lady's saying, I'm 28 years old, I've got 2 kids, both deliveries were natural, normal, and after my second child I found that I had to go to the toilet frequently. I haven't experienced anything embarrassing yet, and I haven't gone to any doctor. Please advise.
Okay, so this lady's shown the very predictable changes that a lot of women find following a delivery, and
Would that be the stress incontinence?
So this sounds more like what we call, this might more be related to an urgency picture, and a lot of women who have what we call urgency find that one of the first signs is that they go to the toilet more frequently because they want to keep their bladder empty in case they might indeed get an accident. If there is a little bit of stress incontinence, we also find that women tend to go to the toilet more frequently. There certainly wouldn't be any surgery indicated in this lady, and treatment really does come down to how much it impacts on your quality of life. No one has ever died of stress incontinence, but a lot of women might have died of embarrassment. So,
I'm sure.
so it really does depend on how it impacts on your quality of life.
Okay. Now, just another question that came through, and this lady is saying that she's 45 years old, and she's also got a problem of, having to go quite a few times, pretty much similar to the question that just came through a moment ago. But I think really what comes up in this program is that this is a very common problem. And we're not aware of it because women don't talk about it, because you've mentioned, because of the embarrassment, because it's awkward to talk about it.
Yes, so it's things that women can do on their own. Is just bear in mind that there are some things that tend to impact on your bladder function. Drinking too much water, and there seems to be an obsession in some people that they need to walk around with bottles of water and keep themselves well hydrated. You can do that in excess, and that might be one place that you can actually address, and you probably don't need to take more than about 2.5 liters of fluid in on a day, and so overhydration is a common cause of this.
Okay.
And then simple things like reducing your caffeine intake. We know that normal tea has quite a lot of caffeine as well. And so by reducing your caffeine intake, you might find that your symptoms will improve remarkably. And moving to rooibos tea or green tea, reducing coffee.
So ladies, when you have that tea break, think about what Dr. Stephen Jeffrey just said to you a second ago. So Doc, going back to the overflow incontinence, the fact that you're unable to empty the bladder, can that be a bit painful?
Most women don't have pain with that problem.
Okay.
But it's and I said it normally occurs in the older women.
Okay.
So women in their 70s, 80s, and so it would be really important to see a doctor and to have that checked out if indeed that might be the underlying problem.
Ek luisteraar, weer eens, I'm chatting to Dr. Stephen Jeffrey. He's a specialist at Groote Schuur Hospital gynecologist. And ons gaan eers breek vir advertensies. When we return, we'll keep those questions coming. 021 442 3530 en die SMS lyn 34530. Ons gaan nou voor. Thought-provoking, hot and never really dealt with. That's lifestyle issues on The Voice of the Cape. Hey, welcome back to The Voice of the Cape. We're chatting about urinary incontinence. Now, we spoke about stress incontinence, urgency incontinence, and overflow incontinence, which is when you're unable to empty the bladder. And I'm joined in the studio, my guest in the studio today is a specialist at Groote Schuur Hospital, Dr. Stephen Jeffrey. Now, moving on to the next SMS and the question that came through from a 35-year-old lady. She says that when I was younger, I frequently delayed going to the toilet to urinate. I think a lot of young kids do that, Doc. My mother always told me that I'm weakening my bladder. Now that I'm 35 years old, I find that it somewhat has affected my ability to control my bladder. Example, if I need to urinate, it becomes a matter of urgency, and I've had some embarrassing moments. Is there any medical treatments available?
So this is a very good example of how these problems present, and I'm sure there are many women out there who can actually relate to this question, and so I think this is a very good question. I'm glad it was asked. I don't think what you do as a child, and specifically delaying going to the toilet, will cause this problem.
Okay.
In fact, the treatment involves, for this problem, does involve actually teaching women to hold on and to do exactly what she was doing as a child. And so, in fact, I think holding on as a child can maybe delay the onset of this problem.
All right.
Now, this is a classic example of what we call urgency. Urgency is this almost pathological desire to go to the toilet where you have to drop everything and go to the toilet.
Run.
A lot of women, and they might relate to this, get what we call latchkey incontinence. Is when you're opening your door of your house, you've been out shopping all morning, You haven't had any desire to go to the toilet, but while you're opening your door, you find your bladder starting to tell you that you need to go and pee, and you just make it in time, or you might not make it.
Aye.
That is called latchkey incontinence. But these are the sort of symptoms that we're talking about when you're talking about urgency incontinence. Now, the good news is that there is treatment available. I've already spoken about reducing your fluid intake, cutting down caffeine, but there is medication available. There are a number of medications available. Unfortunately, some of them are a little bit expensive.
Doc, you know what? I think if you've been having some really embarrassing moments, you've mentioned that you're certainly not going to die of it, but you could die of embarrassment. I think it's worth the money. I think it's worth the investment, because you're certainly going to want to pay for it instead of really end up being embarrassed or just letting go right there, right then.
Exactly. So what I personally do is we take it on a stepwise approach. We look at how this is impacting on the woman's quality of life. And then we move on to medication, and some of the medications do have some side effects, including dry mouth. Some of them can cause constipation. But in women who are severely impacted by this problem, we find that the medications do work quite well. If the medications don't work, there are some more advanced treatments for this problem of urgency and urgency incontinence. And one of the more recent developments, and you're all going to find this very interesting, and that is Botox.
Oh?
Yes. Now, I know
that is interesting.
I know Botox has received a lot of coverage for facial wrinkles and making women look younger, but it seems to work really well for this problem of the bladder. Again, as you might imagine, it's quite expensive, but I personally have quite a lot of experience with giving Botox, and this certainly is something that works well in these patients. And as a sort of a last line treatment, it's something that works very nicely.
Now, who would have thought? Botox? Certainly wouldn't have thought about that, Doc.
Yes, so it's injected through a little camera that we put into the bladder, and it can actually be done with you awake, and work lasts for about 9 months. Unfortunately, it's a sort of treatment that does need to be repeated, but I've been very happy with the response in my patients.
Some great results.
Yes.
Okay. Well, I would certainly love to chat to one of your patients and, find out how they and their family members and their husbands has been, how they feel about it. It would be interesting to have them in the studio.
Yes, and it might be a good option. Something that we haven't spoken about is the management of the other problem of stress urinary incontinence. Now, that is managed by putting a little sling or tape under the bladder neck. And that is quite a small surgical intervention. Involves a cut just under the bladder. It's all done completely with the patient asleep.
Okay.
And that is a good operation when it is done for the right reasons.
Okay.
And we've had very good successes with that.
Okay. Well, I've certainly learned quite a bit today, Doctor. Interesting chatting to you, and we're hoping to have you back soon.
Thank you very much.
Thank you. And that's specialist gynecologist at Groote Schuur Hospital, Dr. Stephen Jeffrey.